Over the past year, there has been a boom in the growth of AI, increasing the global market by over £60 billion since 2022. This is due to advancements in technology, but also due to a shift in the view in which we look at AI. Before, the idea was to create physical hardware with the ability to think independently, but as of quite recently, we shifted to the notion of using task-specific AI. This is not only cheaper to manufacture, but also easier to use. In the same way, instead of trying to create new technology, we can shift our view to utilize what we have today to its full capabilities. This is why I believe AI has many potential uses in the medical field. One of these potential uses is improving the technology in hospitals. Pagers, also referred to as bleeps in the NHS, are used in 4 out of 5 hospitals in the UK. This means that sleeping doctors on a night shift are alerted the same way to major and minor issues within the hospital. This increases the already immense stress that doctors feel due to the uncertainty of the problem at hand. In addition to this, it can take up to 30 seconds to receive a signal from a bleep, which may not seem like much, but in the frantic environment of a hospital, this can be the difference that saves someone's life. A solution to this issue can be to use smaller devices implemented with task-specific AI that can not only alert the doctor of the problem instantly, but also the severity and the precautions that should be taken when dealing with this issue. This can be achieved by using different sensors and cameras to compile information instantly and send it to the doctor. This technology is already being used in things like smart AI motorway cameras and baby and pet monitors. If we're able to shift our perspective, we can use this technology to save lives. Another way of using AI's capabilities is implementing it across the country to help people check their health. 63.8% of the UK adults are either obese or overweight according to the BMI scale. This can increase the risk of many diseases such as type 2 diabetes, high blood pressure, high cholesterol, and more. Self-service health checkup machines are already widespread in the UK, but their uses are limited and outdated. Implementing new AI software into these pre-existing machines will enable them to accomplish much more. Companies such as Google are working on implementing this new AI technology into their smartphones. This can help detect the risk of diseases such as high blood sugar, elevated lipids, diabetic retinal disease, and tell you the precautions needed to avoid them. If this technology is implemented across the UK, even people from lower income households and families will be able to take advantage of this technology and help them live longer and happier lives, especially because these areas tend to have the high rates of obesity. The money collected from things like sugar taxes can help fund these operations to help further promote the government's efforts of enhancing public health. Implementing AI in hospitals across the UK can enhance health and happiness, yet it poses challenges ethically, particularly in sensitive areas such as hospitals. A key concern with the collection and the analysis of people's sensitive data. As AI usage grows, it can analyze data, improving its accuracy, which is positive. However, we must adhere to the Data Protection Act and its regulations towards safeguarding and privacy. Moreover, as AI advances, it could potentially replace healthcare workers, raising ethical dilemmas such as job loss and the loss of human connection when dealing with patient care. This can be crucial for recovery of patients both physically and mentally. We can already see this technology being implemented in automated booking of GP appointments and other aspects of the medical field to make sure people's experiences are more streamlined. As AI grows, its potential applications are infinite, but we must use its capabilities ethically and responsibly if we want to unlock its full potential. Thank you for listening.